I'm Dr. Mosammat Shahina Begum. I'm working as a consultant in a BRB hospital of Dhaka, Bangladesh. I came here for a training on reproductive medicine and infertility through the Merck Fertility training program, Merck More Than a Mother, Merck Foundation. I applied for the training previously and they select me for this training, and this training is for 3 months. Actually, in my country, though this country is burdened with population, but there are lots of infertile patient, infertile couple, and day by day this problem is increasing, maybe due to lifestyle, maybe due to environmental pollution, or there may be lots of reasons behind this. In our country, before 2 to 3 years back, the people were not so much aware of this problem, but now they consult with the fertility specialist earlier. But according to population need, I think there is lack of fertility specialist and also infertility center. There are total 13 running infertility center in my country with up to tertiary level services are available, 1 from government sector and remaining 12 are from private sector, and most of the centers are situated in the capital city of Dhaka. 2 centers are at periphery. And there are also 15 infertility specialists. They are working in that center, and 7 or 8 active embryologists are available in my country. One of the limitation is that we are lacking of embryologists, and we have to depend the embryologists from abroad also. So it is very difficult to do IVF and ART due to this lacking of embryologists. And as the people are not so much economically in well status, so all the people cannot provide the treatment cost also. The government don't cover the treatment cost, and there is no insurance covering also. That's why all people cannot provide the treatment cost, and medicine are little bit expensive in my country. And there is another thing is that lack of some family, there is lack of awareness and lack of education. So that's why all people cannot reach the tertiary level center, and also there is shortage of infertility specialists, so all people cannot also reach the center. And there is one I think it is system. The problem with the system is that there is no referral system actually. So one patient can consult with that tertiary level specialist, and one can consult with the general practitioner also. So sometimes the problem which can be solved with the GP, those patients consult with the tertiary level center, and the patient who needs to consult with specialist like severe male factor infertility or severe form of endometriosis, they should go through that ART treatment directly. They never consult with the consultant also. I think these are the challenges. Merck Fertility Training Program is very much important for me, for my patient, and as well as also for my country. This training program is concise, and it is divided into 2 groups. First part is 3 weeks lecture and followed by 1 exam, and remaining part is practical session. We are placed in the outdoor ultrasonogram room. We can counsel the patient with consultant, do ovum pickup, and we also visualize the embryo transfer. And in our lecture part, all lectures are with excellent materials and with recent update and according to American Reproductive Medicine Society guidelines. So all lectures were very much excellent and up to date, and it was also much informative to us. And after that lecture there was an exam, so all the students have to go through the lectures. So we are enlightened with recent knowledges. If we are enlightened with this knowledge, we can serve the patients in a better way with recent update and confidently. So my patients also get benefit from the training program. And another thing is that though my country is burdened with population, but there are lots of infertile couple, infertility patients, and infertility problems are increasing day by day. So lots of people also, but according to patient need, there is lack of infertility center and infertility specialist. So lots of people every year they go outside for treatment purpose. I think that it is an economic loss also for the country. If I can serve my people in a better way, most of the people will treat themselves in my country. This will reduce the financial loss of my country, and this will also improve the health sector at a glance. So I think that directly I will be benefited from this training program, and my patient and my country will be indirectly benefited from this Merck Fertility training program. In my country, most of the people are staying at rural area. These people are far away from education, also from awareness. So that's why they are not aware of the problem of the infertility, and still due to lack of education and awareness, they believe that the infertility problem is mostly concerned with the female partner only. So in the family, still today the female partner are blamed for the infertility, but we know that both male and female are equally responsible for infertility, but male factor is far away from the light. Especially the female partner, sometimes the couple were socially, all the people socially block them to maintain any social communication, any conversation or any social program. They are all separated from that program. They believe that it will bring harm to next generation. But day by day the situation is improving. The male factor is coming under the light, and sometimes the responsible and educated male partner willingly ask the doctor to exclude the male factor infertility before going to start any treatment. So due to the social media, newspaper and television, some movie also, I think the people are becoming educated, and they are become responsible regarding this sector. And I think the problem will decrease day by day, and the both male and female factor will be come in front regarding this ground. Actually, there are multiple cases seen in my country. One male person, he got married gradually 4th time. First time no issue, divorce. Second time, third time, and finally 4th time this couple consulted with an infertility specialist, and that time it was diagnosed that the person is azoospermic. So 100% problem is with male partner, but every time he blamed his wife regarding this issue. And another thing is that I know one doctor couple, the female doctor was very well known to me. They underwent ART treatment, but finally the female doctor did not conceive, and lastly they divorced. They got divorced due to this issue, and that male doctor again marry another person. And another thing is that I know a couple. The problem is with male partner. He is azoospermic, and they become the parents of a baby through the IRSI treatment. But every time the mother-in-law denies that the problem is with his son. Every time she blames that the problem with her daughter-in-law, and due to maintain the balance, the female also take the responsibility on her shoulder. And again this couple came for the treatment for ART, but second time they failed to conceive. Actually, I came here in an open mind. I know that this training is a good training from one of my country fellow. That's why I applied to Merck Foundation, and they select me and gave me the opportunity to take this training. This training is divided into 2 parts. One is theory and another is a practical session. The theory was excellent and with all of recent up-to-date knowledge, and there was also one exam after the theory part. In practical part, we are placed in outdoor session, and we were tagged with one specific consultant with whom we consult with the patient, took history, observed the ultrasonogram, especially the TVS, and also performed some TVS with our own. We also observed the ovum pickup and assisted our teacher and observed the embryo transfer. And then we also have the opportunity to observe and assist some endoscopic operation also. So we are covering every aspect of the theoretical and practical aspect of infertility with recent knowledge. I will give one advice to new aspirants that they should go through any book of infertility before coming to this training, and they should know ultrasonogram, especially transvaginal sonography is very essential, and if these two things are available in their country, they should go through before coming to this training. It will be helpful for them. And to optimize this training, everyone should stay in the hospital up to the maximum level, and also should follow the advice, the instruction and recent knowledge of the recent knowledge regarding infertility with the consultant. And there are some seminar and teaching classes ongoing, a 2 to 3 days gap or every weekly. I will advise that don't miss these classes. And also after the outdoor session, there are some field works also with the for the patient and some practical session. So some consultants are very much academic. They give some study to go through in the room also. I will advise all newcomers that this training is for 3 months, so he or she should spend their most of the time with the consultant, with the hospital and with the books also. Just now I am working in a tertiary level general hospital. There are only in infertility ground, there is only outdoor facilities are available. I do IUI in another center. Before coming to this training, I requested my hospital authority at least to establish IUI setup within this period. Actually, some expansion is ongoing. So I think after completion of this work, the IUI setup will be there. But up to the tertiary level setup, I have to wait. But I can perform IVF and ICSI in another center. And another way, I think that to share the knowledge, the best way is the teaching. So I have a plan to organize some seminar and workshop to give the knowledge and to share this knowledge with my colleagues and my junior fellows. By this way, I want to implement my knowledge of this training. Yes, I want to give heartiest thanks to Merck Fertility Training Program, Merck More Than a Mother and Merck Foundation to give me the opportunity to attend this training program. This training program is excellent and very concise and very practical actually. And I think that it is an excellent initiative to train up some doctors and some embryologists from abroad, and they can give service to their own country. And I think this IIRRH, this is also an excellent center to provide such a training, and there are lots of students from home and abroad are coming every day for taking training on infertility. And so finally I will give my heartiest thanks to Merck Foundation, Merck More Than a Mother and Merck Fertility Training Program and IIRRH for providing such an excellent training.